down in Bar Harbor. And Chrissi, it's a tough day down in Bar Harbor with the announcement of the closing of the labor and delivery unit. Tell us about why you made that decision and what you've done today.
Thank you, Chris, for finding some time to talk to me about this incredibly difficult decision. Amongst these challenging headwinds that we have in rural healthcare, we had to make this decision. We've been working on strategies for the last 9 or 10 months with the noted significant decline in birth rates on MDI and specifically at our hospital. And as we started to continue to evaluate just the demographics that we serve and how we can evolve and change and what this landscape will look like, it's a challenging, complex service that labor and delivery requires with multiple levels of support services. And when the amount of babies continues to decline, the ability to maintain skill-based competencies and patient safety were the primary reason we had to focus on how do we either continue to foster relationships for skill-based competencies and grow births that are actually in this county are declining at a 35 to 40% rate, and on MDI in the 55% to 60% rate. And we've seen this trajectory over the last 9 years. It has continued to decline. Last calendar year of 24, we delivered 32 babies, and so far to date, we've delivered 9.
Yeah.
And it's a difficult decision. Our team, I'm so privileged to work with these highly skilled, compassionate caregivers who have been able to sustain us to this point, and would love for us to continue to try and figure out how we can do this. But at some point, you have to make the decision that our community members believe that we are doing this work and we are providing a safe environment, which we are truly trying to do, but it is not a sustainable model with the low birth rates.
I've seen some of the comments on Facebook. People are commenting, well, MDI hospital is expanding. How can you expand the physical plant and yet cut out this crucial department?
Yeah, the maternal health. Part of what we have been evaluating along the lines with our community health needs assessment is what our community has valued and what are the needs of the community, and matching our strategic growth and our strategic investments along those lines. The maternal health and labor delivery, it has always been a mission-driven initiative for this hospital, and when we were able to sustain 80 to 100 or over 100 births, we were able to share the pieces of the pie where providers were able to deliver enough to keep their credentialing up. So that contraction made it very difficult. The investment that's being made in the expansion in our emergency services department is all being done through philanthropy and grants. So it's not impacting the operations of the facility. Doesn't mean it doesn't impact the patients being able to get in and out of the facility, but it's not meant to be a choice between keeping emergency services or keeping maternal health services.
What happens to the labor and delivery nurses, the people that are working in the OB and the labor delivery area of the hospital?
We will be working with all of our teams for transitions into open vacancies that we have throughout our organization. MDI Health has 13 health centers that have nursing-based care, a med-surg unit, an emergency services unit, oncology, infusion. There are several areas in the organization that, should our team wish to transition into, we would make a pathway for that. And they will continue to deliver babies through June 30th.
Right. You don't envision anybody, losing their job per se. I mean, there are other opportunities for.
There's other opportunities, absolutely. And we are also investing in creating a position out of our Lisa Stewart Women's Health Center, which would be a women's health navigator,
Yeah.
which would help with pre and postpartum services that we can retain on island for convenience and care close to home, and also be that warm handoff and transitions of seamless care to a partnering and referral partner.
What happens if someone goes into labor and in the minute, um, oh my God, I'm going into contractions.
You come
I
right
mean,
to so part of our planning will be unanticipated deliveries, and we will be ramping up our emergency preparedness plan in our emergency services department for that work. And part of this, whenever a licensed hospital has to close a unit, we have been working with the state of Maine and the Department of Health and Human Services and following their very prescriptive guideline on how we do this work. And part of that is to have a competency, a training plan, and a preparedness plan for unanticipated deliveries that would arrive in our emergency department.
I mean that, with the influx of tourists in the summer, I mean, you could see that possibly happening, someone going into early labor and we don't want to say that MDI hospital is solely for tourists because we know 100% that's not the case.
No, but for anyone
yes,
who's on the island, right? We want them to know that we are deeply committed to the care. And Chris, this is deeply personal for me. Both of my children were born here,
right,
at this hospital. And I feel like there's so much grief in closing this unit, but so much to celebrate in how many lives we actually touched throughout the many decades of being able to have the privilege of serving so many families and making an impact on the lives of so many. But the fact is we are still going to care for this community, and we're going to find those wraparound services that will allow us to provide outpatient services for maternal care and then make sure that there's a competent labor and delivery plan, as well as having a wraparound emergency contingency plan.
and the pediatrics department is still
Yeah,
they're 100%, and I mean it's just the actual
inpatient
delivery.
labor and delivery. It's the inpatient labor and delivery. All of our pediatric providers remain here and on call, and would be available for pediatric admissions and support as well. So that piece of what we do through our primary care service network continues uninterrupted.
So someone is a couple months pregnant. Walk us through what's happening. I mean, because obviously they're not going to be able to deliver at MDI hospital after July 1st.
Exactly. So we have a log, if you will, of potential births that could arrive at MDI or choose to have their babies at MDI. We have begun notifying all of those patients about this decision and how we will be reaching out to them to work on a transition plan. We are working with our neighboring referral partners, including Northern Light Maine Coast, Eastern Maine Medical Center, to develop those partnerships and seamless transitions. Obviously, for our patients, Maine Coast and Ellsworth is the closest hospital. Right. And we want to make sure that those relationships, especially with this navigator, are able to help make that smooth and not, the uncertainty of this is so hard on an expectant mother. And we want to make sure that they know that we are still here. We are still going to take care of them. And we're also going to make sure that their experience is just as special as it would have been if they delivered here.
Do you know who that navigator is
Not at
yet,
this
or
point.
not?
Not
Okay.
at this point. We are just finishing putting together the framework and the job description, and then we will be posting that position.
Okay. Um, yeah, I mean, and we know that there are, I mean, we talked last month about the need for the supplemental budget to pass. I mean, this isn't due to the supplemental budget. I mean, had that passed, this decision still would have come.
Absolutely. When we talked about that earlier, you even asked me about labor delivery. I said we're exploring it. Our declining birth rates are incredibly concerning
Right.
to us, and we were just in the finalization of this isn't changing, right? This isn't. We're not seeing any growth trajectory here, and all of the CDC demographic evidence, all of the birth rates in this area, unfortunately are very concerning, right? As a resident, as of this community and of the county and Maine, that's an economic concern for us.
Right.
So, but no, that was this. We have been identifying these trends. Back in June of 2024, we started having strategic planning sessions. We met with the state. They have a rapid response team. We have been doing that. So it wasn't, we had a commitment to labor and delivery for so many years, but it gets to the point where our patients have to be our top priority.
Yeah. And I mean, when you talk about that low birth rate, it impacts the schools, it impacts, um, and everything. And, you look at housing, and it's all related,
Right.
unfortunately.
I mean, you can unpack the economic drivers that are leading to this, but you're absolutely right. The largest graduating classes um, for seniors in the United States is this class. The
Yeah.
trajectory after this class is actually of 30 to 40% decline, and it multiplies down. Um, and we're not in Maine. We our births for the entire state of Maine were about 11,500. Our deaths were 22,000.
Yeah.
So our replacement rate, I mean, we need to address this at a state level. And how do we attract young, vibrant individuals to our communities?
We need to have a baby boom.
We do. We
Yeah.
do. Stuart Brecker has some ideas about that, Chris, if you ever want to talk about it with Stuart.
Okay.
But I think it's really important that MDI Hospital is not going anywhere. We've had to make some very difficult decisions about this unit based in really that declining rate, and what is that. Where do you start to see the evidence-based information that starts to really define that this is not not the safest environment when your declining rates are at
Yeah.
our levels.
All right. Anything you want to add that I haven't asked you?
I think just over the next few months, what we will be focusing on is taking care of our amazing care team to make sure they feel valued, and that we have them at the forefront of our decisions. That our patients are always our top priority, and that we want to make sure that they feel well cared for. And lastly, that we are doing the work to ensure that our emergency department is skilled and prepared for any emergency that might arise in an unanticipated delivery on the island.
Uh, and I think you are going to have a town meeting, or
We're
a set
scheduling,
of town meetings.
yep, I'm doing an external town hall. I'm sorry, internal town hall today with my team, with the organization.
Yeah.
And then Mariah is working on Monday on an external town hall.
Okay. And we'll publicize that. So
Yep,
that way,
yep,
if community members do have questions or concerns, that, I mean, you've always been very forthcoming in answering questions. I'm sure you'll be there. And
absolutely.
Mariah Cormier, the and her team will be there as well.
Absolutely.
All right. I hope
All
your day
right.
gets better.
Thank you. I
All right.
appreciate you. And
Thank
thanks for taking some time, Chris.
and you as well. Have a good
Okay.
day.
Bye.
Bye-bye.